Global health leaders, scientists, policymakers, and advocates gathered in Munich, Germany for the 25th International AIDS Conference, organized by the International AIDS Society, IAS. The annual conference aims to galvanize the scientific response, build global solidarity, and enhance human dignity for all those living with and affected by HIV.
To reach the 2030 targets, we must improve access to services and care. We must move away from siloed services and address people's diverse and multi-layered needs. We must vigorously defend human rights and put people first. This is not just a moral imperative, but essential for progress, and is why Put People First is the theme of AIDS 2024.
Under the theme, Put People First, this year's IAS conference underscored the importance of centering the needs and experiences of people living with HIV.
Today, on behalf of all of us in this hall, I make three urgent calls to world leaders. And leaders, I mean political leaders and business leaders. First, ensure that the work to end AIDS is fully resourced. And then, free developing countries from the stranglehold of debt. Second, get the long-acting medicines to all low and middle-income countries. Third, world leaders, lead. Stand for justice. Stand for justice. And end the discrimination faced by girls and women that is driving the AIDS pandemic, especially in Africa.
One person dies of AIDS every minute. One person every minute. That is something we must change. Our common goal is to end the AIDS epidemic by 2030. While we are making progress, there is still some way to go. That is why we keep on working together and globally. As one of the largest donors, Germany contributes 1.3 billion euro into the Global Fund to fight AIDS, tuberculosis and malaria in the current cycle. And we will continue to support it.
Among the conference's many satellite events was the Nigerian event with its themed session, Putting People First, Sustainable Approaches in HIV Response in Nigeria. This critical session conveyed key stakeholders to delve into Nigeria's unique HIV challenges, explore opportunities, and innovative approaches. The Consul General of the Nigerian Consulate, Ambassador Yakubu Dadu, was in attendance to welcome participants. In her address, the Director General of the National Agency for the Control of AIDS, NACA, Dr. Temitope Ilori, called for the introspection on Nigeria's HIV journey and strategic planning for a sustainable future.
Yes, we're doing well. Of course, we have some setbacks, particularly in the area of pediatric HIV and the area of prevention of mother-to-child transmission, and even so many other issues like that. But what happens, how do we ensure sustainability? We all talk about the new business model, sustainability agenda. What exactly sustainability? What are we doing? What are the roadmaps? How do we ensure that when partners withdraw their services, how do we ensure that we can sustain the system? What are we doing in terms of domestic resourcing? I think these are some of the things we really need food for thought for us to deliberate on tonight, and to as we're passing our shoulders for having come this far, we should also ask some of these pertinent questions.
Goodwill messages were delivered by the representatives of implementing partners, community-based and non-governmental organizations, as well as the former Directors General of NACA, Professor John Idoko and Dr. Sani Aliyu. The Nigerian coordinator of the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, also delivered her goodwill message.
Putting people first, I think, is very much a fitting theme. And I don't think anyone can deny the fact that the President's Emergency Plan for AIDS Relief was created to put people first. From an emergency response to today, I think so much has been accomplished over the last 21 years, and especially in Nigeria, where the US government has invested over $8.3 billion. There are marginalized populations and individuals sitting in this room who can't just walk into a health center and expect friendly, comprehensive health services. So what does that mean? It means that there's a lot more that we need to do to ensure that we reach 95, 95, 95, that we eliminate HIV as a public health threat by 2030. I believe that we can do this. I believe we have the leadership with our coordinating minister, our Minister of State, our DG. I believe that it's a choice. So I think today, and when we return back to Nigeria, let us all commit to that choice of putting people first.
The keynote address was delivered by the Minister of State for Health, Dr. Tunji Alausa.
The theme of the International AIDS Society in 2024, putting people first, aligns perfectly with the renewed agenda of the President Bola Ahmed Tinubu, GCFR. This theme resonates deeply with a sector-wide approach for the health sector in Nigeria, which is centered on innovation and sustainable solutions. Also, a focus on sustainability within the HIV space is premised on empowering government-mandated structures to deliver on their mandates rather than creating parallel structures, with implementing partners providing technical support to them.
The Minister of State discussed some key initiatives from sessions of the IAS conference that aligned with that of the federal government of Nigeria.
In my participation at the many sessions at the conference, including the abstract-driven sessions, I was impressed by several initiatives that aligned with our strategic objectives. Number one, domestic production of HIV commodity. As the most populous country in sub-Saharan Africa, Nigeria plays a pivotal role in regional fight against HIV, enhancing our capacity for domestic production of HIV commodities will not only meet local needs, but also enable us to support neighboring West African countries and sustain the HIV response in those countries as well as ours. The second strategic objective, stimulating local economy. Recently, we have restricted tertiary facilities from purchasing foreign needles and syringes to boost local production and sustain our healthcare sector. We're working quickly with all our development partners as well, that all the RDT, the diagnostic kit that we will be using in the country going forward, will be either locally assembled or locally manufactured. We have to get away from this barrage of importation into our country.
Yes.
We need to improve our local capacity. I call on all stakeholders, both domestic and international, to partner with us in transforming our health system, starting with the HIV program.
Highlight of the event was a panel discussion focused on partnership and transitioning for sustainability of HIV response in Nigeria. The Nigeria event at the 2024 International AIDS Conference highlights the importance of people-centered approach to the HIV response. By putting people first and prioritizing their needs, we can accelerate progress, reduce inequalities, and create a sustainable HIV response in Nigeria.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.